Good morning, everybody. In New South Wales to 8 p.m. last night, we had just over 110,000 tests, which is positive, and continue to keep those high test numbers. But unfortunately, we had an increase in case numbers from yesterday to 291 cases of community transmission. There are a number of cases still under examination, but at least 50 of those were infectious in the community. And I do want to foreshadow that given this high number of cases, we're likely to see this trend continue for the next few days. So I do want everybody to prepare themselves for higher case numbers in the next few days, just based on the trend in the last few days and where things are going. I'm expecting higher case numbers in the next few days, and I just want everybody to be prepared for that. But pleasingly, and I want to provide updates, we get information the preceding 2 days on how many people have been vaccinated in New South Wales, and on Wednesday 84,000 people received a jab in New South Wales, which is fantastic. We really want to increase that number. The more people we get vaccinated, the sooner we'll be able to live more freely, and I really want to stress that point. Life for us on August 29 will be a reflection of how many people have at least one dose of the vaccine and where the case numbers are. And those two things are the things we'll look at to see how we can live beyond August the 29th. And obviously, once we hit the 70% vaccination rate, life will be much easier, and of course once we hit the 80% vaccination rate, life will be as normal as we can expect during COVID. I do want to make 3 important points today. The Canterbury-Bankstown local government area is proving to be the area where cases are increasing the most. So all the suburbs in the Canterbury-Bankstown area really need to be on extra alert. There'll be more police on the ground. We are seeing too many people frequent certain shopping areas and perhaps not doing the right thing. So police will be more present in the Canterbury-Bankstown local government area to ensure compliance, and we have to make sure that happens because we don't want to see these case numbers continue to grow into the next few weeks. Pleasingly, education and health have provided a roadmap forward for HSC students. So firstly, obviously the students who live in those 8 local government areas of concern will not be able to have any face-to-face time for the foreseeable future until otherwise advised. However, in areas outside of those local government areas, there will be a flexible model for HSC students who need to go into the classroom for whatever reason in order to pick up material or do some face-to-face exams or whatever is required. But health and education have worked out a very safe way for that to occur. It won't be normal classes, but certainly it will be a level of presence to ensure that no students are disadvantaged in terms of acquiring their qualifications. Trials will be done at home, and at least it means that there is certainty and all students know they'll qualify for the HSC. But also, obviously, importantly, from Monday next week at Kudos Bank Arena, HSC students in those 8 local government areas will be invited to get the Pfizer jab, and most of those students are between the ages of 16 and 18 years of age. And we do encourage all students to make sure they come forward for that opportunity, because obviously by the time everybody sits for the HSC exam, which is a requirement, we want every student from those 8 local government areas to have been offered the vaccine and to have taken the vaccine. Just to stress that every student will receive an email on how to book online next week, and there'll also be a call centre set up for parents to call if they have any questions. There'll also be good advice on what is the safest way to get the student or for the students to go to the vaccination hub. We obviously want to avoid any gathering, any congregation, anything which breaches social distancing or any mixing of households, and that's really, really important. We certainly don't want the virus to spread whilst people are going to get vaccinated. I'm even prepared to read the call centre number, which will go online soon, which is 1800 922 886. So for parents who want information or for students, in addition to receiving an email on how to book, that call centre will be available for people to access to get information on how their student or the student can get vaccinated in those 8 local government areas from Monday. I also, again, want to really, literally send out a call to arms to all arms in New South Wales. Please come forward and get vaccinated. I can't stress that enough. We are doing better than what we had previously in terms of the number of people getting vaccinated every day, and that's a positive. I can't tell you how important it is for us to get those vaccination rates up, because it will give government better options on what we can do moving forward, and certainly the health experts will feel more confident giving us advice once we know we have higher rates of vaccination. And I do want to provide ongoing updates to the community on how our vaccination rates are going, because that will ensure that we have targets to look forward to. And if we get to 6 million jabs by the end of August, that certainly gives us options from August 29. So I can't stress that enough. Thank you to all those people coming forward, and I hope you find the booking system and arrangements more easy to get through, and clearly that is really critical for us at this stage. Thank you.
Thank you. There were 291 locally acquired cases of COVID reported in New South Wales to the 24 hours to 8 p.m. last night, and there are currently 304 COVID cases admitted to hospital, with 50 in intensive care, 22 of whom require ventilation. And again, we see the pattern. The people that are in ICU are predominantly not vaccinated. With out of the 50 in ICU, 44 people are not vaccinated. 4 people received their first dose of AstraZeneca, and 2 people have received their first dose of Pfizer. So again, to reiterate, 1 dose does afford protection, some protection, but 2 doses provides a greater degree of protection. So we've also recommended that in terms of AstraZeneca, please come forward if you've had your first dose of AstraZeneca within that 4 weeks period for your second dose. So bring that second dose forward to get that complete protection. In terms of deaths, sadly, we've had a woman in her 60s. I'll start again. A woman in her 60s from southwestern Sydney died at Liverpool Hospital. She tested positive for COVID on the July 29, and she was not vaccinated. She acquired her infection in Liverpool Hospital, and that was a transmission in the hospital. This is the second death connected with the recent outbreak at Liverpool Hospital, following the death of a man in his 90s, which was reported on the 2nd of August. Can I personally extend my sincere sympathies to her loved ones? It must be a very challenging time for them. In terms of an update on the Hunter and Central Coast cases, I can confirm that there have been 2 new cases of COVID in the Newcastle area. There have not been any new cases reported from Central Coast. The 2 new cases in the Newcastle area mean that there have now been 7 cases in the region, and the Central Coast case numbers remain at 9. Of the 2 new cases in Hunter, one is a woman in her 60s, is linked to the known Central Coast household cases announced yesterday, and the second, a woman in her 20s, is a household contact of the case in Newcastle that we announced yesterday. So all of those new cases we're announcing are linked, but again, I am urging the Newcastle community and surrounds to come forward for getting testing so we can be assured that we aren't missing any chains of transmission. Obviously, Hunter and Central Coast, Hunter is in lockdown, similar to the same as Sydney at this time, and that's for a week. Now, clearly, once we get through this, we need those high testing rates to give us that assurance that we're not missing those chains of transmission. Again, can I call out the areas by suburb that the Premier has indicated? What we're seeing is some flattening of the curve in Fairfield and some of our other local government areas. But what we're not seeing, we're seeing escalating cases in Campsie, Bankstown, Lakemba, Punchbowl, Wiley Park, Yagoona, Greenacre, Earlwood, Bass Hill, Canterbury and Chester Hill. So it is important for anyone going into that area for essential work, working in that area, living in that area, to be very, very vigilant. We are seeing transmission, potentially around shopping areas. And so again, I urge everyone, do not enter shops when there are other people in the shop. Wait outside, keep your social distance, wear your mask correctly at all times, and stay safe.
Thanks, Kerry. I just want to direct my comments to the young people who are in the 8 LGAs of concern, local government areas of concern at the present time. You have your HSC coming up in October, and in order to be able to do that safely, for you to be able to go and to sit your exams, you're being given a golden opportunity to attend the Kudos Bank Arena next week. We've seen our Olympic stars go for gold. We've seen the most amazing stars in the Kudos Bank Arena. I think there's been Lana Del Rey, Keith Urban, Pink, Madonna, just so many people. You have the chance to go to that stadium next week and actually land some gold by getting your first vaccination, your first Pfizer vaccination. New South Wales Health and Education are doing everything to back you in and make sure that you can go safely to your HSC exams by October. But what we really need you to do is to go for gold next week. We have about 24,000 of you who can get along to the Kudos Bank Arena next week. And the way you do that is that there will be a link come out to you, there'll be messages come out to you with a letter that will explain what you are required to do. But what you are required to do is just keep safe, basically. Get along to the Kudos Bank Arena. You can get there by your own car or by public transport. Maybe mum and dad can drop you. If mum or dad or one of your family drop you, make sure they stay outside the arena, because we don't want too many people obviously milling around inside the arena. Make some arrangements for after you've got your access to that golden opportunity of the vaccination to wait outside for you. And to mums and dads, I just want to say, and to the young people themselves, that if you need to make a call because perhaps there's an issue that you're not quite certain about, or that the email that comes out to you, you've still got questions, then you can ring 1800 922 886. I'll just repeat that number, 1800 922 886. This is your big chance to really go for gold and to star next week. You're getting an opportunity that so many others haven't yet managed to achieve, and it's there for you, and it's there for you to really light up your future by having your safety and security looked after so you can sit your exams come October. I want to stress that to the mums and dads, your children will be well looked after inside when they arrive. They'll be literally ushered. We'll have nurses, we'll have some of the youth command, we'll have some of the young police from the various operations within police there just to guide them through as to where they go. They'll be looked after every moment inside the stadium, and they'll be well cared for. So mums and dads feel secure. We've got about 24,000 students we're aiming to get through next week. The messages will come out this week, and the opportunity is there, but really you've got to take it, grasp it with both hands. I know if you talk to any of our Olympians, I'll tell you, you just got to grasp opportunity, and this is an opportunity, so don't waste it.
Two deaths from the Liverpool hospital outbreak. Long waits at Westmead yesterday to get patients into hospital. We're hearing patients already in hospital some of them are being pressured to leave the hospital if they can to create more space. You maintain that the system is coping?
Yes. Well, what I said to you and to others is that, and I think I saw it quoted in today's one of the papers, is that the health system is under stress, as you'd expect. Because there are a number of cases that are coming into our hospitals, and obviously there are patients being cared for. But I want to thank our nurses, our doctors, our cleaners, our administrative staff who are there every day putting themselves at the front line to keep us all safe. And I would just say again to people who might want to walk into our hospitals, if you do have COVID symptoms, so cough, cold, temperature, anything that you think might be COVID, ring ahead and let them know that you are coming in so that they can keep themselves safe. We have to keep our health staff safe so you can be safe. But certainly anybody who thinks the health system in any country where we have a Delta variant is not under stress is kidding themselves. Of course it's under stress. But our staff are doing an amazing job, and I thank them for doing that. Sorry.
There's been now a number on that Liverpool hospital where the death was. Has that outbreak been confined to the geriatric ward, and do we have an update on the number of patients and their status?
I haven't been advised of any major difficulties at all there, so I'll have to come back to you on that tomorrow. I'm sorry.
If I could ask you about this as well. Obviously, this is quite concerning for people hearing this from in those 8 LGAs from West and South West Sydney. Can you provide any guarantees to Year 12 students from those areas that they're not going to be disadvantaged in any way compared to people from outside?
Absolutely. Education and health have been working together to make sure that no student sitting the HSC, no matter where they live in New South Wales, will be disadvantaged. And that's why we're giving the students in those 8 local government areas of concern the opportunity to get the vaccine from Monday next week. It's a policy that we strongly support. We hope students and their families will have conversations and make sure they provide that opportunity for the student to come forward and get vaccinated. It's really, really important because we know it's a requirement that students have to sit a public examination for the HSC. We want to make sure that in those local government areas where we know the virus is particularly prevalent, that every student has the opportunity to be vaccinated, to make sure that by the time the exams come round there's no question about spreading the virus. And that's really, really important. We know, given where the numbers are, given the experience of Delta overseas, that we now have to live with Delta in one way or another. And that's pretty obvious. And the higher the vaccination rate, the safer we all are and the more free we all will be. And that's why we really want families to have those conversations. There's a hotline, as Minister Hazzard and myself have announced. There's a safe way to get to and from the vaccination hub, which will be outlined as well. And there will be an individual email sent to every single student on how they can book for next week. And we appreciate the challenges this poses, but it's also a great opportunity for a couple of things. Firstly, to keep the students in those 8 local government areas vaccinated and safe. And secondly, we know that the vaccine has to be targeted in particular in those 8 local government areas of concern. We know that even one dose of either vaccine gives you enormous protection from spreading it, from getting it, and from staying out of hospital. But what we also know from what the health experts say, and in fact I got a briefing about that this morning, is it does take around 3 weeks for the effect of the vaccine to kick in. So just because you've had the jab, don't think that you're okay. It does take about 3 weeks for either vaccine to really have the desired effect, and that's why we've got in early, made sure we organised the opportunity to allow those HSC students to get the jab in those local government areas, because it does give us more options down the track. But it also means they'll be well prepared to be able to sit their exams and qualify for their HSC. I know how difficult it is for families dealing with students and students themselves going through the HSC, but please know, especially for those who've been working so hard, you'll be able to sit for your exams, you'll get an HSC, but obviously trial exams will be done at home throughout Greater Sydney areas. But there'll also be flexible models available for communities, for principals to adopt, to make sure Year 12 students outside of those local government areas can go in and select locations, obviously have any face-to-face contact they need to, but it will be done very safely, and Health and Education have signed off on the strict regulations and strict guidelines that will be followed. But the important thing is to make sure that every Year 12 student knows that they'll attain their HSC, they can look forward to the future with confidence, and we know for a fact 2022 will be much, much better than 2021 or 2020, because our population will have a high rate of vaccination. And so when these students go on to further education or apply for jobs, they can look forward to the future with confidence, knowing that the worst period, hopefully, of their lives is behind them.
You've said that you wanted to take the jabs out to those communities in the hotspot areas. MPs in those hotspot areas say that viable churches and mosques aren't being used for vaccination hubs, yet your government has spoken, New South Wales Health has spoken and arranged with the Clubs New South Wales to use their facilities, which is perhaps not as culturally sensitive to some of those groups. Are you going to be using more of those facilities?
Oh, can I say that I've had direct conversation with community leaders on places of worship, and some places of worship have already started having vaccinations. So can I please strongly stress that that work is already being done at a very micro level, and we're making sure that every different community has had their input, and I've personally been involved in this process, so I can assure you it's happening. Personally been involved in the process to ask community leaders what is the safe place for their people to come to, their community members to come to get the jab. So we've spoken to primary health carers, to various religious community leaders, but also community leaders more broadly, and also people who are familiar with various places throughout throughout southwestern Sydney. But it's also important for us from a health perspective to have some mass vaccination centres as well, because it's a safe, efficient environment for people to come through and get the jab, and that's why there's walk-in centres at Prairiewood and other places as well. So it's a combination of both. It's a combination of reaching out to those communities, reaching out to workplaces, as well as providing those mass vaccination hubs where people can come in and get the jab as well.
Premier, in regards to contact tracing, we are getting reports that some people are being alerted by New South Wales Health on what would be the last day of a 14-day isolation period. Why would that be happening? Why would there be those delays?
Oh, look, I'm not sure of those examples, but I will say this. Minister Hazzard and I yesterday discussed the extra support we've received in the contact tracing team. The contact tracing team has been expanded, but we also have to rely on people giving us the information of where they've been and what they've been doing, and sometimes that takes more than one interview. It's never our preference to have people wait. I believe that they're the exception. The vast majority of people are contacted in a timely way, but we also do ask for patience, and there's no doubt as the number of cases increase, so does that mean that resources are stretched further. But we have seen a huge boost in the number of people supporting our contact tracers. And can I please give a huge shout out to our contact tracers? For example, there was one incident which a contact tracer alerted to us at 3 a.m. in the morning. So these are people that are on the job 24/7, contacting people as soon as we know someone's positive. They're ringing them at all hours, including at 3 a.m, which alerted us to a particular situation which could have been a super spreading event. So please know that our contact tracers are there 24/7. Please appreciate how difficult their job is, and I know how frustrating it is when people have to have those waits, but we are in the middle of a major outbreak, and I just ask people to follow the rules. Just stay at home. None of us should be really leaving the house unless we have to.
But Premier, what's the capacity of the contact tracers? We're getting close to 300 a day now. You know, at how many hundreds per day before it's impossible for the contact tracers to keep up?
Well, look, I know that our contact tracing teams have been boosted by several hundred people, including ADF support. So the resources are there. And that's why we just ask people to be patient. And of course, if we need further resources, we'll make sure that happens. But there's no doubt the more cases you have, the greater challenge it is. I'll just see if anybody else wants to comment on that point. Yeah.
Look, can I just say that, again, I want to repeat the thanks, because I don't think it helps to have any possible criticism of our tracers. I just want to say thank you to all the tracers. I know you've all been working very hard at doing your job, and you're doing a great job. Can I say to the question specifically that we've actually increased the number of tracers and interviewers, case interviewers, by 60%. Just in the last month or so. And I want to thank, I was actually outside this building yesterday chatting to some of the ADF, both Navy and Army, and I want to thank them. They were actually telling me they were really enjoying working with our health team, and obviously they're extremely disciplined and they know how to do what's necessary. Just answering your question though, can I also point out, sometimes the reason why someone might get a call a few days after, or even a week after, possibly 2 weeks after, is people don't always remember when our contact tracers when our contact tracers ring them and say, where were you on such and such a day? They don't remember. And that's pretty normal. Add to that the fact that some people actually don't want to tell us where they were. And we get all those factors. So it's not that easy to simply be critical of the time that it's taken, because it's quite complex. And as you'd expect with any system that operates in a human environment, people sometimes are forgetful, sometimes deliberately forgetful. I'll just say this to the community more broadly. Thank you to those who are so honest and tell us everything. Thank you to those who dig out their bank accounts and their MasterCards and every other bit of information, their petrol accounts, and tell us where they were. But that is what we need. We're in a Delta virus pandemic now. We're in the worst of the worst type of pandemic in the last 100 years, and we need you really to be honest and to be helpful when our tracers call you.
Dr. Chan, could I please have Dr. Chan just very quickly on an issue? So the family members, a family member of the lady who's unfortunately passed away this morning has told us that she told them 2 weeks ago that COVID patients had been put into her ward at Liverpool Hospital. They say they want to know why COVID patients were put there. Were they put there? She was in there for kidney problems.
My understanding is that there weren't COVID patients put in that ward. Can I just be clear that we know that sadly, the lady was exposed by a health worker who worked across two wards, both the aged care ward and the ward that this lady was on. As we've indicated, there are a large number of people that were impacted by that. You know, I extend my apologies and sympathies to the family, but we know how the transmission occurred, how the exposure happened, and again, my apologies to the family.
Dr. Chan, 123 cases in south-western Sydney LHD and 80 odd in Western Sydney. They're under the harshest lockdown restrictions, we're told, anywhere in Australia. Compliance crackdowns being kicked in. Where are these cases coming from?
It's tough because some of the cases are coming... Look, we've got a mix of things. We've got people that go out into workplaces and come home. Can I just give you an example? There are 12 staff members of the KFC at Punchbowl on Canterbury Road have tested positive to COVID. Anyone who attended the venue at any time in the 7 days from Tuesday the 27th of July to Monday the 2nd of August inclusive is a close contact and must get tested and isolate for 14 days regardless of the result. So I think this highlights, you have one person introduce it to a workplace. If you then have 12 people that become infected because we don't all maintain our social distancing, we share the tea room, we don't wear our masks correctly all the time, we don't get tested promptly. I'm not saying this is related to the KFC, so please don't take that. I don't know enough details to comment about any of that, but it gives you an example that once it gets into a workplace, and remember you are infectious before you have symptoms, and then each of those 12 people will go back to their households and introduce it into their households, and then you'll get that cycle of household transmission. So that is why it is so critical that people get tested at the earliest point, and that people, even in workplaces, follow all of the COVID safety practices. Make sure you're socially distanced. Make sure you follow what your employers are saying in terms of the requirements, because we have to break that cycle, and vaccination will help us.
Dr. Chan, in those LGAs, does KFC need to be open? They were closed in other jurisdictions. New Zealand did this. They were particularly harsh on fast food restaurants and the like. Supermarkets could stay open. Could they not be closed? Could Bunnings not be closed in those 8 LGAs?
So I think it's really a balance about access to food and other things that people need. I think my major point would be minimise your exposure in those settings, minimise your shopping. You should be out of your house for the most minimal times, and please don't go out unnecessarily, and don't use shopping as a social event in any way.
Some GPs are postponing second doses of Pfizer to 6 weeks. Others are doing it for 3 weeks. What do you recommend they should do?
So I recommend at the moment that we do extend the doses to 6 weeks. As I said, I understand that GPs will have booking systems and it is challenging. So this is my general comment, and individual GPs will be doing what they put forward as best in interest of their patients, knowing their particular circumstances. For instance, they might have a healthcare worker that they particularly want to get vaccinated and protected fully. So the rationale is that one dose gives you about a 70% protection. So by using all your first doses and getting those vaccines into arms, then you end up having a better net overall impact on your patients.
Dr. Sharp, can I ask you? Sorry, Dr. Sharp, can I go back to the case at Liverpool Hospital? You mentioned that the infection came from a staff member. Does that mean that you would have staff who might be working in a COVID ward, but also working on other wards?
The person was infected in the community and brought it into the hospital. So the way that infection occurred was that the staff member brought it in unknowingly into the hospital, and the transmission event occurred.
Premier, the regional people... Premier.
There are clearly still people that are afraid of the AstraZeneca vaccine, regardless of all the recommendations given. There are also people clearly still waiting for the Pfizer jab. Some of them have died and some of them will die because of the case numbers now. Who's to blame for that?
I don't think that this is at the moment, what we're saying is vaccination is our way of living with COVID, and we need to get vaccinated. Now, clearly we have 2 good, very effective vaccines, the Pfizer and the AstraZeneca vaccine, and it's critical that we use all the tools that we have available. So I can't stress it enough. I look at that immunisation data every day that gets updated on the Commonwealth website, and I am overjoyed that both people are coming forward for their second dose and their first dose of AstraZeneca, and we're also seeing uptake in the Pfizer. But what is also very disturbing is the fact that we have still large numbers of elderly people over 70 unprotected. And my challenge to the community is please come out and get vaccinated. If you have got a loved one, help them get vaccinated. It is not appropriate to delay at this time.
Dr. Chan, we've got the numbers that we're seeing at the moment. Dr. Chan, sorry, if I could ask you a question, if that's okay.
No.
Are the cases, if they get any higher, the Health Minister says that the health system is under significant stress at the moment. If the case numbers get to a certain point, will we have to address field hospitals and other emergency measures to deal with the influx into hospitals?
Oh, look, just to reassure everyone, anyone's urgent health needs are able to be met by our hospital system. We have a very large hospital system and a very integrated hospital system. At the moment, we have 50 people in ICU, and we certainly have increased capacity. And when we cease elective surgery, that frees up that capacity. So the system is a large, vibrant one. Yes, it is under stress, as you'd expect it to be, but I don't want anyone thinking that they can't get urgent care, and that is critical. Please do not delay if you require care urgently. The system is there to treat and respond to that, but the system is under stress.
Premier, just in relation to Premier.
And can I just add one point to that very important point, and that is we know even one dose of the vaccine keeps people out of hospital. So the higher our vaccination rate, the lower the hospitalisation rate. So we have enormous capacity still in the system, even though things are tough and there's extra pressure, obviously, on resources. There is enormous capacity there, but the most important message to get through is if you even have one dose of the vaccine, you have a greater chance of staying out of hospital. And, of course, we've seen to this point in time, there hasn't been anybody with both doses of the vaccine who's ended up in ICU. So we know the vaccines work. So if anybody is concerned about hospitalisation, please go get the jab. Please make sure that by getting the vaccine, you're helping stop the spread, you're keeping yourself safe, but you're also keeping your family safe. And that is a really important message for us to get across.
The Teachers Federation is meeting. Sorry, the Teachers Federation is meeting to decide they don't want to go back for Year 12. They're very anti them returning to classrooms. We're also hearing from a number of parents outside of those LGAs who don't want their children to go back. Is there any assurance you can give either of those, teachers or students, on what level of interaction they'll be having within classrooms? How small will it be?
Look, I understand that our education people have already reached out to stakeholders, and generally people have reported back that they're generally comfortable with what we've put forward, because it is really up to the local area, depending on what the risks are in that community. But it's also about making sure, and this is really important, making sure that every Year 12 student has the opportunity to receive their HSC. And so many students have worked so hard. I can't imagine. I mean, I still have trauma when I remember my HSC, but imagine trying to do it in a pandemic. And I can only imagine the pressure everybody's going through. So as you appreciate, we've found a good balance where we're keeping everybody safe, but at the same time making sure that students will be able to sit their HSC, they'll be able to do their trials at home, and make sure that those students who do need to have that level of face-to-face for whatever reason, it might be to pick up material or for major works or for those courses that involve drama or those extracurricular courses, or curricular courses that involve that oral examination, that we make sure that every child has the opportunity to receive their HSC, and we've done it in the safest way we can. And I think we made sure that our priority was to support Year 12s during this time. But the priority of the government remains, I mean, getting children back at school and getting people working are our priorities, and that's what we're working towards. And the two things that will drive that as to what September looks like will obviously obviously be the rate of vaccination and also where the case numbers are. And they're two things that will drive our ability to consider those things.
You mentioned Canterbury, you were focusing on Canterbury Bankstown, but regarding the hotspots in Sydney's west and southwest, I know Canterbury Bankstown, the system is in place, but are you going to need to spread the requirement for workers to be tested every 3 days through a further region? And with rapid testing, is there a chance of more rapid testing being used in workplaces?
Look, all those things are being considered. We've had very good conversations with industry. Bosses and employers are keen to make sure not only that all of their workers are virus-free, but also that there's regular testing. So that ongoing activity is continuing. But let me stress, the best way to protect workplaces from the virus is the vaccine, because we know that it stops the spread, it reduces the spread, it reduces the rate of hospitalisation. For example, some places where workers have to go together is even if they're delivering food or all of us have to eat, all of us have to attain certain services. So those workplaces, no matter where they are, have to continue working. And if the virus is spreading in those workplaces and then people are taking them home to their households, we'll see how the cycle continues. One way to break the cycle, which is why we're focusing our energies into those 8 local government areas, is for people to get the vaccination. But I also want to stress, as the health experts tell us, it takes 3 weeks for the vaccine to be effective. And that's why, even though you have the jab, please know that it does not protect you until 3 weeks. So the best way to protect workplaces, the best way to break the cycle that we have of cases escalating, is to get the vaccine. And I can't stress that enough. I don't know anywhere in the world, and if anybody does, please let me know, where they've been managed to control the Delta strain without a high level of vaccination.
Premier, with the sewage detection,
Would you support employers insisting on vaccination to allow their workers back in the workplace? And with the HSC, will you be requiring students to provide proof before they enter a big exam room?
Well, firstly, the issue about workers and mandatory vaccination is one that workplaces have the right to do, obviously. If a company decides they have a particular policy of who's allowed to work in their workplace under a pandemic, during a lockdown, well, that's a matter for them. In relation to students and other categories, what we're doing at this stage is providing positive incentives for people to come forward and get vaccinated. And that will continue to be our policy. But to have the opportunity in those 8 local government areas for every HSC student to get the vaccine is a good opportunity, as the Minister also said. So we're urging parents and families to support their students in coming forward and getting vaccinated, but we also ask that you please be safe when you're going to and from those hubs. You may not have seen your friend for a couple of months, but don't abandon social distance, don't abandon those really important ways to keep each other safe. You have to assume every time you leave the house, especially in those 8 local government areas, if you look at the figures in Canterbury Bankstown, the chances of someone having COVID in that local government area are very high compared to other parts of Greater Sydney. So it's really, really important to make sure all of that is done safely. But we are definitely in the phase of having positive incentives for people to get vaccinated. I think sitting the HSC safely is a pretty good incentive. And that's why we're encouraging every single HSC student, and we know that also requires family support to make sure that happens. We've got the hotline, we've got the emails that will be going out to students, and of course I'm sure if they speak to their principals or teachers, they'll also be able to get some advice on what to do. But it's really, really important. If you're offered the vaccine, now more than ever, please come forward and get vaccinated. And I've been pleased with the increasing rates of vaccination we've seen in New South Wales in the last week or two. It's very encouraging. It does mean we'll get to that 60% or 70% sooner than perhaps would otherwise have been determined. So when you hear about certain vaccination rates happening before Christmas, please be assured in New South Wales we're racing to do much better than that. By the end of August, if we have 6 million jabs, that's at least, between 45 to 60% of people who would have at least received their first dose, or over 60% of people with their first dose. That gives us more opportunities for what we can do in September. And I just urge everybody to please come forward and get the jab. I can't stress enough how vital that is to help all of us, to help New South Wales out of the difficult situation we're in. And we know the science tells us the jab reduces the spread. It keeps people out of hospital, and it gives us choices in how we live freely moving into the future.
Premier, on the regional spread, Premier, you've said this is the harshest lockdown Australia's ever seen, but the case numbers keep rising. Do you concede that we've said goodbye to COVID zero forever now?
Look, I think it is a challenge for us to live with COVID without those high vaccination rates. And we do have the harshest lockdown, especially in those 8 local government areas, but we've never dealt with Delta in the way we've had to deal with now. So that is the one difference. We do have the harshest lockdown, but you can't compare the results to any other lockdown because that wasn't with the Delta variant. This is a very different, it's almost, I'd be medically incorrect if I said it was a different disease, but it's definitely a far different disease that we've seen of COVID, a different strain. It's doing things that other strains did not do. It's highly contagious in ways we'd not seen it before, and therefore we have to deal with it in a different way. Fortunately, we have an additional tool we didn't have a year ago, and that is a vaccine. We know it works. We know it reduces how contagious people are. It really makes sure people are staying out of hospital. And imagine if we didn't have the vaccine. I mean, as tragic as every single death is, but imagine if people hadn't been vaccinated with at least a dose, how many more people would be in hospital or intensive care now? The numbers are always tragic, but they would have been far, far worse even if we hadn't had that level of vaccination.
Is it possible now to get close to zero? I mean, the question was asked, have you given up on that?
Well, look, it's obviously a challenge for us to get down to that number, but that has to be our aspiration. We have to try and get down as low as we can. And but what I do want to say is that the government will be looking at 2 things: where the case numbers are at, but also our vaccination rate. Because even though we may not necessarily be going back to life pre-COVID or pre this outbreak, we can have more freedom once we get those vaccination rates up, and that is the key. I know there are lots of things people want to do that they can't do now. I know I've got my list. I'm sure everybody does as well. But we'll be able to look forward to those things once we get our vaccination rates up, because as you see around the world, there are safe ways of giving people more freedom when you have certain rates of vaccination. Obviously 70 and 80% gives us those opportunities to get to those pre-outbreak conditions. But until that time, until we hit 70%, we will have limited freedom. However, we will have more freedom once the rate goes up.
Premier, yesterday you talked. Premier, yesterday
He hasn't asked me a question.
On the regional spread and the sewage detection that's popping up around the state, some epidemiologists and certainly regional people are begging for a ring of steel or a wall of hope or whatever we want to call it. Is there any plan for stricter travel rules or checkpoints to protect Sydney people travelling?
Oh, can I say the following? There are already police out there in large numbers supported by the ADF. There's enormous compliance. We've tightened the rules as much as we can without limiting basic services that people need to receive. But let me be very clear. Delta doesn't understand borders. It doesn't understand boundaries. We are dealing with a different strain. And unless you have literally a police officer outside every single household in New South Wales or on every single road, a ring of steel does not prevent Delta from seeping out. And as we've seen, this is why a few weeks ago, it feels like a few weeks ago, Dr. Chant and I said what's happening in New South Wales is a national emergency, because Delta acts differently to any other type of COVID strain that we've had. And we have to accept that, and therefore we have to accept the best way to get us out of this difficult situation is obviously people doing the right thing. Stay at home, don't leave unless you have to, but also get vaccinated. And those 2 things will help us more than anything in getting through this difficult time.
Premier, just one
last question. Who's asked this question? Can I just say last question?
Premier, just on essential.
I've got a question.
Just on essential workers that are being, you spoke yesterday about targeted vaccination of essential workers. You've set a target to vaccinate 24,000 Year 12 students in 1 week. Why not set a similar strategy or target for those essential workers who are the ones that are seemingly moving the virus around?
Well, please know that we're vaccinating tens of thousands of authorised workers every single week. We were still, at the beginning of this outbreak, still vaccinating aged care workers, which were supposed to have been vaccinated previously. So please know, as I said, that's why I was very keen to provide vaccination updates during these updates, because on Wednesday alone, when 84,000 people in New South Wales got a jab, and can I assure you that a large proportion of those would have been authorised workers. That was the last question. See you tomorrow. Thanks, everybody.
Thank you. Thank you. Thank you.